So they are not having any periods for the whole year. You can see. Why does someone stop seeing periods? Now, there are two very small that are on the right and left of your uterus. Now, believe it or not, as women, we are born with the amount of eggs we will ever have. We don't make eggs. Unlike males, so unlike Brent and Marlon, they will make them every 72 hours. 72 hours? Yes, every 72 hours. That is why a man can be 90-something and still have children. Woman, you have a bad clock, literally, because when all your eggs start running out, so every month you may have a period, you release an egg, and estrogen is a very dominant hormone in females of reproductive age. Now, there is some contribution of estrogen from fat cells and also the adrenal glands. Those are two glands located posteriorly in our abdominal region. But just like how the eggs are declining as you age, estrogen starts naturally declining because literally the ovaries start shrinking up. So they get smaller and smaller, they become more atrophic, and estrogen production gets less and less. Now, I cannot tell you how important estrogen is to the body. Estrogen is so important, it affects every single cell in your body, from the crown of your head to the sole of your feet. So it has important function for your brain, for your heart, for your vagina, for your toes, for your skin, all of those organs that I just spoke about. Estrogen plays an important role in keeping these organs supple, juicy, healthy, and very functional. You with me so far? All right. So when would we expect the actual onset of menopause? And remember we said menopause is when you stop seeing periods for one full year. The average age is about age 51, right? So by age 51, most women seeing any periods, okay? Now, you can also go into what we call surgical methods. So your surgeon or your doctor may offer you surgery and say to you, we have to remove your ovaries for whatever reason. Once those ovaries are gone, you have, you landed right into menopause. And sometimes you may not have the time to transition gradually into it. It may just be so sudden. So that's surgical menopause. And then we have some medications that menopause, such as chemo. So those medications, they can actually shut down the natural function of the ovary, and you can actually go into menopause as well. All right? Now, what about the transition into menopause? We spoke about that being the perimenopausal period. Now, on average, 4 years prior to the last period, you will start the transition into menopause. So, what am I saying? If on average you stop seeing periods completely by age 51, then 4 years prior to that, roughly around 45 to 47 years old, you're experiencing symptoms associated with menopause. For natural menopause, the estrogen function. So instead of your 8 days, you may start having very erratic. This month, the next month, it might be 12 days, then it might skip 2 or 3 months, then comes back with a fury where it's flooding you. persons, depending on whatever gynecological issues they have, may experience different symptoms associated with their periods. You with me so far? All right. So then what is happening in a nutshell? You have biochemical changes because estrogen, you have physical manifestations, and we'll talk about that. This is where I mentioned how estrogen affects everywhere from your hair to your toe. So manifestations will start to be seen. So for some persons, the hair start dropping out, the skin getting drier and drier. No matter how much you moisturize, you find that you're just dry. The vagina might start getting dry. You don't have a desire for sex anymore as much because you actually start losing your libido or your sex drive. And that is why I said it's very important for partners to understand this, because a lot of them take it personally. They think, you're withholding or you don't want to have any sort of relations with them. But it's genuinely your body is not in that frame of mind at that time for sex. So it takes a very understanding partner to appreciate the changes that you are going through. All right, and that is where the psychological implications come in as well, because it affects your relationships with your family. Women can tend to be more moody, irritable, they're short fuse. That's because the actual brain and very easily, because they say, but I just tell you that, and they don't understand that you genuinely just forget. And parents could genuinely irritated the process they are going through. All right, so we spoke about this. All right, we spoke about this. Now, for those of you who could see this slide, if you look at it very well, it really encapsulates all the changes that a woman would go through. And if you look in it, good, that's hair changes. Then you could have headaches and hot flashes. Hot flashes come literally from a decline of estrogen receptors in the brain. That also causes the headaches. Then you could have your teeth loosening and your gums start receding. So stop making fun of old people when you see that, the teeth shaky and they look like they have more gums than teeth. Don't make fun of them. It's just a natural. Because the plumpness and the rosiness and the nice hips and the porky breasts will not last forever. I promise you all that. Lifestyle makes a difference with how you cope. But I'm saying you may never get to that Coca-Cola shaped model figure again, just because of the natural changes that are occurring. All right? So we're moving down now. Women, you may find the need to go to the toilet more frequently. Whereas you could have slept through the whole night and don't get up to pee, now you're getting up 2 and 3 and 4 times to pee. What happens now? The bladder gets shorter, the actual cells that line the bladder gets drier, and so you find the urge to pee a lot more. What happens to the vagina? That gets drier and shorter. So whereas you had a very lengthy vagina before, now the vagina is so short, it's more painful to have sex. You need more lubrication to have sex. You need more foreplay to disturbance in the early transition period, and 38 to 40% will experience it late. Another common symptom, another topic that I'm very passionate about, because we tend to not talk about these topics too often for whatever reason, but it affects so many women, and that's vaginal dryness. Now, hear me out. Estrogen is responsible for maintaining the cells of the vagina, the urethra, the bladder, and the vulva. Okay? Estrogen maintains collagen content of the epithelium, and that's the cells that kind of line that area. Estrogen also maintains the different acids and enzymes around that area. Estrogen maintains blood flow. So imagine estrogen doing all these things to your bladder, your urethra, and your vagina. Now take that away. What do you think is going to happen? Changes in the vagina will start happening. So, whereas the cells there used to be thick, rugged, and rich in glycogen, and the glycogen is then used by the normal bacteria that is in the vagina, this change that usually occurs when you are in your peak or in your reproductive years, this now, your body loses it completely. So these are the things that starts happening now. There's thinning of the top layer of the epithelial cells. The elasticity of the vagina is lost. We call that loss of rugae. The vagina shortens and narrows, so the vaginal canal gets smaller, right? So again, I could say this. Okay, well, our child is going out now. Right. So, whereas if you are accustomed to a particular size of a penis, right, and your vagina starts to shorten, right, and it starts to get more dry, that size of penis now will then become a little bit more uncomfortable. Right? So it takes a lot more lubrication and effort. You with me? All right, great. So what other changes can occur? You have decreased vaginal secretions. So again, it would contribute to you not enjoying sex as much. And then the vaginal pH increases. Now here why the vaginal pH is very important. The vagina thrives in a very acidic environment, right? The acidicity of the vagina is what prevents you from getting all kind of bacteria and fungus multiplying and causing chaos. So once the pH loses its acidity, then you're more prone to yeast infections. You're more prone to something called bacterial vaginosis, where there's a frequent foul, fishy odor in the vagina, and you're more prone to urinary tract infections. You see how this menopause thing could really affect you? Simply because now you're losing the pH of your vagina naturally, because estrogen is what supports and keeps it in its acidic environment. So the vaginal dryness, those symptoms get progressively worse the more you transition into menopause, and the dryness, the lack of estrogen causes vaginal dryness, itching, and this word, dyspareunia, means painful sex. What happens from the urological perspective now? The urinary tract, they have some embryological origin, mean they are formed from pretty much the same mechanism or tissues, just like the gynecological organs. And then urgency, discomfort when you pass urine, and increased urinary tract infections. This menopausal time is also a risk factor for what we call pelvic organ prolapse. That is where old people would say your womb start to drop out, right? So the vagina may start protruding out of the vagina. The actual cervix and uterus may start protruding out of the vagina as well. That's because the skin there gets very lax, secondary to decreased estrogen. All right, so we're moving along. It stands to saying menopausal women are likely to develop depression. Risk is greatest in the menopausal transition, and for some persons that are they're having very terrible symptoms, we tend to treat with estrogen. So your symptoms of menopause can vary from mild, moderate, to severe. So not everyone will experience all the things that I mentioned, or they might experience it in varying degrees. So it might be mild features for some, others they might be more moderate symptoms, others might be very severe, where we actually have to offer them estrogen replacement to help manage the symptoms. All right. Cognitive impairment, we spoke about that, where you get forgetful and you just lose your memory. You can't remember where you put things. You feel like your head always beating. You might see some people doing this all the time because something just don't feel right with their head. Now, long-term complications of menopause, we spoke about the bone loss, the cardiovascular risk. Again, estrogen plays a very protective role on the heart. So if your estrogen, then you are more at risk for cardiovascular disease. Okay? All right, we talk about cardiovascular disease. Now, let's talk a little bit about hormonal replacement. Now, one form of treatment for symptomatic women. And the goal of the therapy to give them hormones is to relieve their menopausal symptoms. So if you only have, say, complaints that are associated with vaginal atrophy, then we can give you local estrogen instead of systemic estrogen to treat the problem, right? If your only issue, say, is sexual dysfunction, we can give you something local from the vaginal perspective to help manage, right? All right, so hormonal replacement therapy is not recommended for the prevention of menopause. So not because you're transitioning into menopause, you must line up by your doctor to say, I need hormones because my hormones are being depleted. Because hormones, especially estrogen, it comes with its own risk. Risk of stroke, right? Risk of clot formation. We do not recommend it for any individuals with chronic illnesses. So if you have hypertension, if you have diabetes, not recommended because of the risk of stroke and blood clot formation. So each person, you'll have to have a thorough history taken from your physician, and we have to see if you are a candidate for hormonal treatment. Now, hormonal treatment is available in many forms. You can have it in tablets, vaginal creams, and vaginal rings. So who is a good candidate again? Safe option for healthy, symptomatic women who are within 10 years of menopause or younger than 60 years of age without any contraindications. For women with recurrent symptoms after stopping hormonal replacement therapy, non-hormonal options should be considered. And again, hormonal replacement therapy should be individualized. So let's talk about non-hormonal treatments because The truth is, our population in St. Vincent and the Grenadines, we are plagued by all kind of issues. Diabetes, hypertension, obesity. So already, a lot of persons won't be a suitable candidate, not unless you probably had your ovaries removed at a very young age for whatever reason, and you transition or you go into surgical menopause. You may find your physician actually offering you hormonal replacement treatment, because you'll have a long time of menopause where for sure issues can happen to you. So there are alternative treatments we could offer, non-hormonal treatments. Antidepressants for those women who are going through cognitive impairment, who are depressed, who are concerned, who are worried. Even anti-epileptics have been known to work for some individuals with cognitive impairment. And then we have hormone treatment or alternative therapy. All right. So with antidepressants now, you can find a clinical response would be more rapid than the typical response for depression. It's equally effective in women with breast cancer, surgical, or natural menopause. With the anti-epileptics now, the main one is gabapentin. This can be prescribed. This is effective for women whose hot flashes would occur at night. And at very high doses, gabapentin can be comparable to estrogen, although there are some side effects associated with gabapentin, such as headaches, dizziness, and because of that, we tend to limit its usage. In terms of alternative therapies, the evidence supporting each alternative therapy is not 100% strong in terms of randomized trials, but we do see a lot of individuals responding very well to herbal treatment. Again, what may work for Anisha may not work for Kevin, what may work for Sister Jennifer may not work for Sister Jackie. And that is the nature of any medicine. So obviously, it takes an ongoing discussion to find out what may be suitable for you. There's cognitive behavioral therapy, where a psychologist can sit with you and help you to have sleep hygiene, sleep patterns, may tell you, try sleeping at this particular hour, try using sound effects, rainfall, things that will calm you and help you to actually sleep a lot better. Mind-body-based therapies such as stress management, relaxation, deep breathing techniques, prayer and meditation, they have all been associated with helping severe symptoms of menopause as well. Then there's plant-based therapies. There is natural estrogen that is found in soybeans, chickpeas and lentils, flax seeds, grains, fruits and vegetables. So if you have started experiencing symptoms of menopause, it may be a wake-up call to just try changing up your diet. Have more of a plant-based diet, have more of these particular natural estrogen producing foods. The area of potential concern is that phytoestrogens, these are the estrogens found in the foods. They have both estrogenic and anti-estrogenic effects, right? This means it may work for some and it may not work for some, right? The experts recommend that dietary soy is okay in women with breast cancer, but to avoid dietary supplements until their safety has been established. This is for women with actually breast cancer undergoing chemotherapy. So again, the data is not that very consistent. I can't tell you for sure this will work for you, but it's promising. And if, as Bible believing persons, we believe in the health reform and the plant-based diet, then we could only imagine there's tremendous benefit in this for us. All right, there are also other herbal therapies such as evening primrose oil, black cohosh, some Chinese herbs, paced respiration for those individuals who are suffering from severe palpitations. It may be just to intentionally breathe. Weight loss can help with that as well, and exercise play a very crucial role in your overall well-being and how you feel. All right, spoke about this. So we're coming to a close now. So what does Jesus think of menopause? No, the word says, knowing not that your body is a temple of the Lord. And of course, I know God is interested in how you feel. God foresaw that all these changes that we just spoke about will happen. And therefore, as a Bible-believing person, we have to hold on to the fact that He has made provision to help us cope with these transitions that we are going through. As I said, it may be talking about it with a friend, having open discussions like this, knowing that you're not alone, because some persons really go through what they go through, and they feel it's them alone going through it. But it really helps when you could share your experience, talk about it, and find kinship in other persons going through similar situations. So in summary, our population is aging and feminizing. Menopausal transition is a significant period in a woman's life. It starts approximately 4 years prior to your final menstrual period. The hormonal changes affects the female physically and mentally and has implications on all areas of her life. And it's prudent for us to be able to identify and manage these issues. Thank you very much. I hope you've learned something, and I am open to questions at this time, if anything is unclear.
Thank you. Thank you for that very informative presentation. I learned a lot. The last thing you said was that it is 4 years prior to the pause of right. Is there a test? I didn't hear you say anything about being tested to know whether you are.
Yes. Yes, very good question. So yes, we can measure your estrogen levels. We call that estradiol, and we could see what it looks like in comparison to what we know it should look like in your reproductive years. So your estrogen levels, your luteinizing hormone and your follicular stimulating hormone, they tend to rise as you're transitioning into menopause, and estrogen tends to drop. So yes, there's a test. Next question. Okay.
You have the over-the-counter, just like how you can go and get a pregnancy test. You have the over-the-counter menopause test. How reliable is that test?
I am not familiar with every brand, but I know there is some brands that are pretty reliable. But just like the pregnancy test could give you false negatives or false positives, it's always best, instead of your finger prick, to get a venous blood sample drawn. That would be more sensitive and specific as opposed to finger prick. So it can be reliable, but in some cases it may not. Depends on manufacturer, brand, expiration date, etc.
Now, if you're already in menopause, right, is there a time limit, or would you always have symptoms after?
Right. So usually from the onset, so the early transition phase, which takes place 4 years prior to your final period, the period of perimenopause and menopause lasts approximately 6 to 10 years. So no, you wouldn't suffer forever. It gets better because your body will now adjust to the fact that your estrogen levels have been low.
Another question is there anything that can help with the frequent urination in the night, like if you go more than twice, 3 times?
So the local estrogen creams can help, and also we tend to advise do not drink any sort of water like 3 to 4 hours prior to going to bed. So that might limit you to getting up once as opposed to 2 and 3 times. But if it's really bad, we really recommend the estrogen creams just to give the urethral lining a little bit of estrogen so that the cells are not dried as much, and so it will quiet down the symptoms.
I have one other question, just a little one. Does your sweat glands are affected?
Yes, they are effective because your apocrine glands or your sweat glands, they do have estrogen receptors. So yes, in a nutshell.
I just say that to say, right? For me personal, over the years, I could have gone without a roll-on sometime, not all the time. Let me say I forget, right? And I go somewhere. I won't have a problem. Oh, that I smell sweaty also. But I noticed like in recent years, like recently, like sometimes you forget that and then you start to feel like, you know,
Dirty.
smell sweaty.
Yes, definitely could affect it.
We have 2 hands.
Bear with me sitting down, eh? I was on my feet all morning at the hospital.
Okay, I have few questions. In concern with the bathroom breaks, how can you differentiate someone who is having these bathroom breaks with someone who is diabetic? Because the first thing that you will do when you start doing that, they will say, are you pre-diabetic? Are you diabetic? So how would you know when someone is diabetic from menopausal symptoms?
Okay, very good question. And I think it's very important that we not just assume it's menopause that we're going through. So any new symptom that arise, we always tend to rule out. So if you're having change in your urinary habits, if your urine has become more painful, you're bleeding, or spotting when you pass urine, a good healthcare provider will always rule that out first to ensure that there's nothing pathological. So, because some persons may literally have some strong bug growing in their bladder, and it may not even be related to menopause and the changes, because you can have UTIs outside of menopause as well. And you have stones that could contribute to similar symptoms, bladder stones, renal stones. So it's always good to rule out pathological issues.
Okay, and it's the same with bladder. As you say, the estrogen is really important in our body makeup for all these things, right? If when your levels start decreasing and you're having these symptoms, is there anything that you can continue eating? I saw you put the diet there, but when you are actually going through the process, can you increase in your diet and that will help?
Yes, yes, okay. It can help, especially plant-based healthier foods. It tends to make you less lethargic, less slow. Some things we could attribute as well to menopause, but some really has to do with diet and what we choose to put into our body. So the healthier we eat, the less our symptoms become amplified.
Okay, my last question, right? You said that 4 years prior, one can know that, but suppose this individual does not know. What are the symptoms is to look for?
Okay, so the first thing that tends to happen is the hot flashes.
Okay.
Right? And then the sleep disturbance, the insomnia, you're having difficulty sleeping through the night. Those are the first 2 common symptoms, and it wouldn't just be isolated. You will find a pattern, right? So those are the earliest symptoms that tend to occur, most common and earliest.
Okay, so in that sense, like also can someone do a blood sample?
Yes, you can. Same thing Sister Nicole asked.
Okay.
The same estrogen levels, you will notice that they start falling.
Okay, and so so we see that our diet plays an important part in that. So might not do that. If this person, a lady vegetarian, because I got to understand not everybody go through all these symptoms. They can probably go through this period of their transition without feeling hot flashes,
Right.
without having nothing at all, this sort of stuff.
Correct.
So what can they do if they're not having that? And for
No.
example, with the partner, okay, they are female already and they're not going through that. But for their partner, their partner sometimes go through stages of transitioning, not what we call menopause for us women. And they are trying to let their partner know that certain other, for example, remembering things. How can you advise someone in that stages of
So you're saying
So-
the woman doesn't have any symptoms, but the partner?
right, in terms of, well, not so much like the hot flashes or anything, but it might not remember things.
Oh, okay. You
Right?
mean other symptoms?
Yes, and for the partner, the male, to understand, like, okay, then I'm not seeing these symptoms is in you, and what is going on, like, you're not remembering thing, is this like you just don't want to do
Right.
things yet?
So it really takes a conversation because at the end of the day, as I said, everyone would not have the same symptoms. If you have a partner and your partner is concerned about something, you have two options. You be open with your partner, let your partner know, okay, well, I believe I might be at the age where I'm transitioning into menopause. However, I do not have a lot of the typical symptoms, except, let's say it's loss of sex drive, right? But this is happening to me, and this is how you can support. And support means differently for every person. So how I may want support may not be how you want support, because we have different needs, we have different partners. Each partner may not exactly, desire the same thing. So it requires a very frank conversation with your partner, letting them understand. And sometimes if that doesn't work, you're unable to explain it properly, then your healthcare provider, like for me, I have a lot of couples coming in, and I talk to both of them, counsel them, and it's amazing when the male partner is enlightened how things can change. They just need to be, aware of what is happening, because a lot of them think it's them. Oh yeah, you're looking at next man. How can I excuse you here? That's why you don't want me anymore, or whatever the case is. But it really takes that sort of frank conversation. And if you can't do it for yourself, say, let's go to see the doctor together. And that can help. Okay? You're welcome.
Okay. Then you notice for women, when we're going through menopause or perimenopause, a lot of weight is being put on, especially on the stomach
Yep.
area. Is there anything can be done to avoid that?
Other than the exercise and the lifestyle changes, the calorie deficit, we really do need to eat less as we age, because our metabolism slows down. We don't need as much fuel as we did when we were in our 20s and 30s. But you see, in our population, we eat the reverse. The older we get, the more we eat. But it's the little teenagers that need way more food than us, So Joma should be eating way more than Marlon, right? So that's naturally what should occur. So it's really to cut back on portion size, recognize from the time you hit 40, every individual need to recognize that half the plate need to be their vegetables, right? And whatever vegetables, quarter their protein and quarter their wholesome carbs. So like your grown provision. But we're so not used to eat like that, to eating like that. We tend to have half the plate with the carbs and the salad is the dressing. And me and my husband always fight for this, right? But it is the truth, right? We should be eating the reverse, like really half your plate with your vegetables, whether it's half your plate with callaloo, even if it's one you could afford. Let's say it's callaloo, half your plate with that. So you're cutting back on your simple carbs, which just gets transition into fat in the body.
Okay. I think I hear you said, I'm subject to correction. For if a person is thrown into menopause due to surgery at an early age, you sometimes recommend estrogen,
Yes.
right? So let's say a person went into menopause like at age 45, 47 due to surgery,
Yes.
right? And they did not get the hormone replacement at that time.
Yes.
But during the time they're going through and they are the loss of memory and different things, you recommend estrogen therapy to them?
Well, it depends on how they are coping. Because some persons, yes, they get a little forgetful, but they cope okay. We recommend hormonal therapy for those who really have very severe symptoms. So not just the mild to moderate symptoms. At 45, you would have naturally started to transition. So I wouldn't call that early. I would call early menopause anything less than 40. So say at 35, you had your ovaries removed or you had to undergo chemotherapy, then that is what I would call early. But if you're in around 45 and older, I wouldn't necessarily call that early because naturally you would have started the transition anyway. It just came a little bit earlier because it was sudden. And if you're really truly affected in terms of you have multiple symptoms, you're not coping well, then is when we recommend the hormonal replacement therapy.
Okay, thank you. Also, for persons who are losing bone density,
Yes.
even before that, is there anything you can recommend that we can use to avoid us having that loss of bone density?
Yes. So anybody over 40, you need to be on a calcium and vitamin D supplement. And the thing is, because of our complexion, we don't absorb sunlight naturally like white people, right? There is interference in how we absorb sunlight. So if we're to screen 5 persons here or 10 persons here, 6 of you will be vitamin D deficient, although we have the sun here, if you're not taking supplements. So we recommend vitamin D supplementation, calcium supplementation from the age of 40. Of course, it's always good to have your calcium through food, but how many of us would eat as much milk, vegetables to get the recommended daily allowance? So again, you have to know yourself. Those things exist where you could check your vitamin D levels, your calcium levels. Yes, they might be a little pricey, but when in doubt, because I have had patients who say, Doc, I don't want to take supplements, I want to do things naturally, which is fine. When you check their levels, very low. So again, for those persons who don't like dairy, and we tend to stress supplementing dairy with plant-based milk, that helps, but you have to know how much plant-based milk to drink daily as well to get your recommended calcium. Go ahead. Oh, yeah, to get your recommended calcium. Another thing you could start doing is from the time you reach like 40, 45, you need to women need to do their screenings for their heart, which is your cholesterol. So it helps to do your lipid test because naturally your lipids would increase because estrogen is decreasing in your body. But you don't want to spill over to the point of having your cholesterol through the roof, your LDLs, which is your bad cholesterol, through the roof. So those things can do something about it.
Okay, this might be box, but do men go through these
Yes,
the
they
other
do,
word?
and we can have another conversation for our men from around 5 years old. And the most important issue that occurs for them is erectile dysfunction, which they don't like talking about. They feel is the worst. They're embarrassed to talk about it, but it can affect relationships as well. So they are more at risk for like prostate disease and so on. So yes. So while it's estrogen for us, it's testosterone starts falling for them.
Okay, thank you.
So the next program will be on that, okay?
Okay, this came back to me. What I wanted was to ask too. You mentioned that one person can stop their monthly for 12 months, right? And then it can come back. And when it come back, it can come back with a vengeance.
No.
What can be done? Like really heavy. Like if it come back really heavy or light spotting, what can be done for someone
Okay.
going through that?
So I don't want us to be mistaken.
Okay.
So if you stop seeing your periods for 1 full year and it comes back after the year, that is 100% abnormal, right? This is now what we call post-menopausal bleeding, right? So it's what I was describing is transition into your final menstrual period. So
Okay.
in that 4 years prior,
Yeah.
your periods can get erratic. So they
Okay.
might skip 6 months, but once they
Stop for the 12 months.
once
and
you
come
reach
back.
1 full year and no periods, and then it comes back, especially with a vengeance, head straight to your doctor.
Okay. So what can someone in that kind of phase really look forward for hearing at a doctor?
If your periods come after 1 full year,
Yeah.
well, you will need to be walked up, and the important issue. So
What can you say about has, well, we're dealing with women here, going through reproductive changes before, might have laparoscopy done, all this other stuff, endometriosis, and then transitioning into menopause.
symptoms can vary. Those persons tend to have more heavier bleeding, especially if you have a gynecological issues like fibroids or endometriosis, COS, which is now called PMOS, hormonal issues. And as you start the transition, it may cause estrogen receptors to become very erratic, and those persons tend to bleed abnormally. We call it abnormal uterine bleed. And of course, how we treat that person may be a little different because you don't want that person to bleed out the entire blood volume. So it's individualized, the treatment.
Okay. So how you do get that screen that you mentioned? Your family practitioner will do that, or you see the gynecologist only to get the
A
screen?
district doctor can do that, can offer that.
So you just go and ask for that?
Yeah,
Okay.
yeah. You mean the estrogen levels?
Yes.
Yeah, you just go and say, I want to know if I'm transitioning into menopause. Can you send me to do some?
No, you mentioned about the heart. Sorry, that screening.
Oh yes, for sure.
Okay.
They all do lipid screening and so on. Definitely. So on, offer that to your district.
All right. Thank you.
You're welcome.
Symptoms are mild to moderate to severe. Does hereditary have any bearing on that?
Yes,
how
it
my
does.
mother-
Mhm. If your mother had a severe transition, likely you will. We can't explain it, but we've definitely seen the correlation. I remember one patient came in and she said that.
Person's relative?
I believe so. I can't 100% accurately answer that, but I know for the mothers, for sure. Sister Jennifer.
How early can you start menopause?
Okay, so
Because I know some young people go through menopause earlier in their
Yeah.
early age. So
Right. So, again, average year of your final menstrual. Most people would have gone early 40s for some whatever reason. It couldn't your blood supply to your ovary got cut off. So things can contribute to premature ovarian failure.
Because of Jennifer's question, something. Is it a fact that if you go through early menopause, like at an early age, affect, meaning cause you to have Alzheimer's?
No.
I heard that, so that's why I asked the
No.
question.
It can cognitive impairment with the forgetfulness and the loss of memory and so on, but not Alzheimer's.
Thanks. And I just want to make one other comment. You know, I was going through this and I never know it was because of, premenopausal or anything like that. Well, for me, looking back, I realized that, some of these things.
Right. It's true. There's strength in having a support group and a support system to go through menopause. Any other comments? Sister Jamelia, on with us? Any comments? Looking forward to menopause?
Okay. So,
Yes, Brother
question.
Marlon.
What are some myths that people say about menopause?
All right. Myth number one is you cannot have sex in your menopausal period, right? Or postmenopausal period. That is not true. As long as the conditions are right, sex can be still enjoyed and be very fruitful. Well, fruitful is not the word. Enjoyable. Thank you, Marlon. Enjoyable, right? Another myth is with menopause comes rapid changes in your body. The changes aren't rapid. It's always going to be a transition. So you wouldn't go to sleep with porky breasts and wake up the next day and they long, right? It's always a transition. Any other myth? Those are the two. Correct. Yams have, well, that's not a myth, that's a fact. Yams have natural estrogen in it, so it helps as well to yams, yeah. Yams, chickpeas, soy, all of those are very good. Yes. Yes, Sister Jackie.
Time is gone, but our next question, you mentioned earlier that, let me see if I could remember exactly what you said, about your uterus dropping.
The
or
prolapse,
prolapse,
yes.
right. So, what, should you have an operation and remove?
So if you have actually a prolapse, it depends on the degree of the prolapse. One of the earliest interventions we normally offer patients is what is called pelvic floor exercises. So you do what is called this, and we try to advocate you do 500 to 1,000 of that in a day. So like how I sit down right now and I talking, I must sit down do about 3, right? because it doesn't take any effort. You're just doing it. So let's all do it. Clench. That's what you call a Kegel exercise. Eh? No, you know, hold your breath. Right. So you're going to do it till it becomes natural to you. So you're watching TV, you're washing up your dishes, you just try clench and unclench. What you're doing is building your pelvic floor.
Okay.
Yes, Brother Marlon.
I have one question.
All right.
I'll ask the last
Okay.
question.
It's good to see you, my dear. Welcome. And we hope we will continue to see you.
Okay, is it true the earlier a woman got her period, is the earlier she go through menopause?
Yes, because you remember, we only have a certain amount of eggs. So if you started to see periods at 8, right? Then by the time you're probably 48, all your eggs run out. So you may transition into menopause a lot earlier. So that's correct. Yes, Marlon, you had a question.
So, other than encouraging men now to go and plant on a yam field to help our wives, mommy or sister and thing, what else could you advise men to do to help their...
All right. So, number one is really understanding, to recognize that these are physical manifestations that's more than likely she may not be able to help. That's the first thing. The second thing is your wife also needs to be understanding towards your needs as well. So there needs to be some level of compromise. Let's say for sexual relations, it might be using a lubricant if there's dryness, additives that could help to enhance sexual activity. It may be, very good, all right. Any other questions? All right, ladies and gentlemen, you've been a great audience. And so now I will turn you over to Sister Danny. Is it you? Who? Oh, Auntie Alina. Okay. Thank you.
As Sister Baptiste is coming, I just want to take the opportunity to thank the Women's Ministry Department for putting off such a program today. Men?
Or from Women's Ministry. Okay, thank you so much. We have all been enlightened, especially the younger ladies. Not me so much. I went over that years ago. And when we were discussing, I told them, I don't even know what happened to me. No hot flashes, no nothing. I was very lucky. No headaches. Well, I used to have migraine headaches, so that didn't even count. So, ladies, be aware and look after yourself. Try to live healthy and, do what you have to do to make yourself aware and be healthy so that when it does happen, you know what to expect and you know how to take care of yourself. Okay, so to close, okay.
Let us pray. Heavenly Father, we want to thank you for your loving kindness and for your tender mercies towards us. We thank you for your watch care that you have bestowed upon us thus far. We thank you for your words, which our soul prospereth. May you continue to be with us. The session, the information that we have received this evening, I pray that you will help it to be beneficial to us and we will walk towards being a better person of our diet and all the things that is necessary to help us to go through this menopause and premenopause period, because recognize that it is something that every woman will go through at some stages of our life. Be with Sister Damaris and her family. May continue to bless them and may continue to bless our ministry. Into your hands we commit our lives. We do not know what the future holds, but we know that He holds the future. So as we go throughout this new week, we commit our lives into your hands for guidance. Be above us, beneath us, and surround us with your protection. In Jesus' name I pray thanksgiving. Amen.
And if you'd like to share what you learned this evening with a friend or a family member, please do so. Good. Have a good evening, everybody.